Welcome back to LOVEPLUSPET channel. Today our topic is surgery the best treatment for hip dysplasia? There are many surgical options for hip dysplasia, and it is important to understand which patients benefit from which surgery. Some surgical procedures are controversial and some are not. All will entail a recovery period as well as expenses. Both hips need not necessarily be treated surgically. Treating one hip is often enough to yield good results. Hip surgery is relatively expensive and a surgery specialist may be required, depending on the procedure. If you are considering surgery for your dog, these are the procedures to know about. What is hip dysplasia? As with humans, your dog's hip joint works as a ball and socket. If your dog is suffering from hip dysplasia, there has been an abnormal formation of one or both of your dog's hips. When the hip has not formed correctly, it is unable to function as smoothly as it should, meaning that the ball and socket wrap or grind against each other, eventually leading to further deterioration of the hip and loss of function. Left untreated hip dysplasia can severely reduce your dog's quality of life, as the condition causes pain and reduces your dog's ability to move normally. Surgery option: femoral head ostectomy. This surgery is commonly referred to as the FHO and is best used for smaller dogs or very active dogs. Here, the femoral head is cut off and removed, allowing the joint to heal as a false joint. If the dog is not carrying too much weight, a false joint is strong enough. If the dog is very active, a false joint will form quickly. The pet typically does not want to use the leg for the first 2 weeks, but should at least be partially using the leg after 4 to 6 weeks. The leg should be used nearly normally after a couple of months. Many veterinarians are well experienced with this surgery, and often a specialist is not needed. This surgery is typically substantially less expensive than the other procedures. Triple pelvic osteotomy, most commonly performed in dogs under 10 months old. These hip surgeries involve cutting the pelvic bone in specific locations, then rotating the segments in order to achieve improved functioning of the ball and socket joint. As with all surgeries, the cost of this treatment varies, but for most dogs, it will be in the range of $3,000 for both hips. Total hip replacement. Total hip replacement is considered the most effective surgery for treating hip dysplasia. THR involves using plastic and metal implants to replace the entire hip joint, returning your dog's hip function to a more normal range and eliminating most of the hip dysplasia-related discomfort. That said, THP surgery is also the most expensive option. This surgery is usually recommended if the dog is in considerable pain or close to completely immobile. The artificial components used in THR are custom-made for your dog, and the surgery is performed by certified veterinary surgeons. Non-surgical treatment. Non-surgical treatment of hip dysplasia is essentially the same as a non-surgical treatment for any other type of arthritis. There are nutritional supplements to help repair cartilage, pain medications, and anti-inflammatory medications. LOVEPLUSPET specializes in flexible, adjustable, and affordable dog leg braces. The dog hip dysplasia brace provides support and stability to minimize pressure on dog's hip and allow for post-surgical healing or pain-free exercise. Additionally, leg braces for hip dysplasia may slow the progression of this chronic issue. The treatment to hip dysplasia depends on your dog's condition. If you are interested to the hip brace, please see more detail below our video. Thank you for watching.